A plane carrying frozen lobsters from Maine, the U.S., landed in Shanghai, China, early one morning in November 2019. The next morning, Mr. Zheng, a merchant at the South China Seafood Market in Wuhan, China, waited for his shipment of Boston lobsters. Half of the lobsters were sold to regular hotel tenants. A small portion he distributed to another merchant in the South China Seafood Market. 1 month later, 3 employees of this trader successively developed novel coronavirus symptoms. Furthermore, staff from 13 shops near Mr. Zheng's stall became the first batch of infected people after they used the lobster bags to pack the products. Zheng has many WeChat friends throughout the South China Seafood Market, and he trades goods with 2 nearby merchants. Both of these merchants, in turn, happen to be located in the heart of the earliest outbreak of the epidemic. The 6 merchants he interacts with on a daily basis have also been in the vicinity of people who showed COVID-19 symptoms. What exactly is the connection between the shipment of imported lobsters from the United States and the COVID-19 outbreak? In December 2020, the Beijing CDC and several other research institutes jointly published an article in the National Science Review stating that the source of the novel coronavirus outbreak in Xinfadi, Beijing in June of that year was most likely from cold chain imported food from areas outside the country where the outbreak was highly prevalent. Australian virologist Dominic Dwyer, a member of the World Health Organization's COVID-19 origin tracing joint study with China, said, "We all thought the cold chain stuff was a reasonable hypothesis."
One of the possibilities, of course, that Wuhan just happened to be unlucky and the virus came in from somewhere else into Wuhan and then exploded through the market.
The possibility of cold chain transmission of the virus should be taken into account in the novel coronavirus traceability study as mentioned in an article in the U.S. journal Science on 17th of August. Back in October 2020, researchers at the Commonwealth Scientific and Industrial Research Organization in Australia had demonstrated in experiments that the novel coronavirus could survive longer in lower temperatures. One possibility that has occurred to many experts is that the novel coronavirus is able to be transmitted via the cold chain. In July 2019, an outbreak of e-cigarette pneumonia was reported in the United States. In September, the first local case of e-cigarette pneumonia was reported by the CDC in Maine. However, the CDC website for e-cigarette pneumonia is only up to date as of 25th of February 2020. Data collection on patients has also been discontinued. According to the survey, as of March 2021, total e-cigarette sales in the U.S. have increased by almost 50% compared to last year. So, has the so-called e-cigarette pneumonia really gone away? The shipment of lobsters to Wuhan, China, came from Maine in the U.S., where e-cigarette pneumonia was reported in September 2019. In December 2019, data on the e-cigarette pneumonia stopped and an outbreak of COVID-19 broke out in the seafood market in southern China. Until further research is carried out, many questions remain over the origins of COVID-19.